Hi, my name is Lindsey Elliott, and I'm a nursing student at Lee University. And today I'm going to be doing a head-to-toe assessment on my patient. And we're not in a hospital, so some of the instruments that I won't have, but I'll explain what they are and how we'll be using them, and what I'll be looking for in the right position. So let's begin. Hi, how are you?
Good, how are you?
Good. I'm Lindsey. I'll be your nurse today. What we're going to do is just a head-to-toe assessment, okay? Can you tell me your name, please?
Jill Daggett,
Okay, and how old are you?
17.
17. And do you know where you're at?
I'm at my house.
And do you know what we're doing here?
I had to toe assessment.
Okay, so therefore I just checked my patient's level of conscience. So she's alerted ×4. And I looked at her position and her posture, her nutritional status, and her posture and her mental status, and her age is how old again?
17.
17, and her body image corresponds to 17 as well. And her mood and affect is at ease too. So next I'm going to start with her vital signs. So I'm going to start with her blood pressure, her pulse, her heart rate, and her respirations, and her blood pressure. And then I'm going to check her weight and height and then correspond with that to BMI to make sure that we're in a safe zone as that. So first I'm going to start with looking at your skull and making sure that it's normocephalic, and I'm also going to palpate it. Just tell me if this is tender. Is that tender for you?
Yeah.
Alright, I'm also going to check for any lesions. Don't see any. I see the hair is evenly distributed. Okay. Okay. Alright, so now I'm going to palpate her maxillary sinuses. You're going to feel pressure. Just tell me if it hurts when I do this. No? Okay, now her frontal sinuses. Does that hurt?
No.
Alright, can you open up your mouth for me? Alright, there I'm checking her TMJ right here. Alright, now I'm going to check her sinuses. Any soreness?
Mm-mm.
What about here?
No.
Here?
No.
Alright, and I'm also going to inspect her trachea and palpate it. Alright, so next I'm going to start with her eyes. I'm going to do Perla, making sure that her pupils are equal, round, and reacting to light. Let's get my pen light here. Okay, so I want you to look at the wall and then look at this real quick. So look at the wall and now focus on this. Alright, I see her pupils constricted in a timely manner. And now just focus on this again. And again. Alright, now I want you to follow my pen light without moving your head, okay? One more time. And great. And if you can just look up, look at your conjunctiva. Great. Alright, now I'm going to assess your ear. So what I'm looking at is the top of the ear is going to meet her outer canthus of her eye. And also I'm going to palpate the pinna up here. And I want it to be hard, not soft. Is that tender or anything? Okay. Then I'm going to pretend this is my otoscope. So if you want to come right here so I can show you the right position. So this is my otoscope. I'm going to pull up and back, placing my otoscope in there using my pinky as holding the face. So in case my patient turns, I won't hurt my patient. So up, back, and in, looking at the canal and making sure that the tympanic membrane is intact. And then I'm going to do that the other side. So again, holding it like this, if you'll turn your head that way, with my finger right here, up and back, looking at the canal, making sure that the tympanic membrane is intact as well. All right, if you can just look at me. Now I'm going to provide the whisper test. Tell me when you can hear this. Can you hear it? Okay, great. Now I'm going to look at the nose, making sure that's symmetrical to her face, and I'm also going to check for patency. Breathe in for me. And again. All right, I would use my otoscope as well to check for, in the nose, I'm going to be looking at the mucosa, the septum, and the turbinates. Okay. All right. All right, next, could you bite down real hard, check the mouth. All right, I'm going to look at the mucosa here. Okay, open up real wide. And stick your tongue out. Look at the uvula. I'll get my light for you. Say ah. All right, so the uvula is intact. I'm looking at the pharynx as well. And stick your tongue out real hard. And the tongue protrudes midline as well. Let me look at your gums for me. Like this. Her gums are nice pink color and her teeth are white. They're not discolored as well. Okay, so for the neck, I'm going to inspect first, making sure that I don't see the jugular, the carotid pulsations anywhere because you don't want that. So I'm not seeing any of that. Next, I'm going to palpate the carotid at one at a time. Okay. Very nice. And now I'm going to check for bruit. What I'm going to do is I'm going to use the bell on my stethoscope, and I want you to take a deep breath in and then hold it when I'm ready, okay? Don't breathe back out, okay? So to use my bell, take a deep breath in and hold it. All right. Thank you. So no bruising was there. Now I just want you to follow my movement, okay? We're going to look at a round of range of motion. So head down, back up, down, or up, sorry. Side, side. Can you touch your ear to your shoulder, okay? And again, and again. And then can you push against my face? Look at that way. Push. All right, and do it again. Perfect. Okay. So now I'm going to check your heart sounds. What I'm checking for is I'm going to listen for S1 and S2 together, S1 and S2 separate, the rate and rhythm, heart murmurs, and then any extra sounds that I might hear. So I'm not actually going to listen, I'm just going to show you the placement of where I'm going to be doing. And normally I would have my patient take off her shirt, but since it's on a video on social media, we're going to leave her shirt on for her privacy. So if you want to come closer, see the movements. So I'm checking your heart sound. So and then it's going to be over here. Perfect. And now I'm going to check your lungs, okay? Well, I'll do the front first. Okay, let's check your lungs. Put your hair back. So it's going to go above her clavicle right here. Take a deep breath. Thank you. Okay, and can you turn around for me? All right, let's see that. Great, thank you. All right, now I'm going to check her posterior sounds. You don't have to keep breathing on it. We'll turn your body this way so I'm going to show them how this is happening. Okay. And then 8 over here, and then 9. Okay, thank you. If you can turn around one more time that way. So I'm checking here for equal symmetry when she breathes in and breathes out. So take a deep breath in. Okay, breathe out. So her chest wall expands are equal. All right, you can turn back around for me. Okay, so now I'm going to check for the let's see, the abdomen. So lay back for me real quick. Okay, so normally I would have the patient's shirt off, but for this sake, we're gonna keep it on. So first I would see look at the contour of the stomach, make sure that it's not distending at any manner, and making sure I don't see any pulsations in the stomach because we don't want that. Then I'm going to palpate for any tenderness or masses. Tell me what this hurts. Okay, and now I'm going to listen to the bowels starting in the right lower quadrant. I'm just going to lift it up real quick. So right lower, right here. And bowel sounds are present. If no bowel sounds are present, I would listen in a quadrant for at least 5 minutes. So. Okay, thank you. If you could sit back up. So I'm going to check for the upper extremities. First, look at, I'm going to feel your temperature. So your temperature is warm and equal bilateral. On the skin on the top portion, I don't see any lesions, scars, or bruises that would concern me at all. Now I'm going to check for the nail beds. The nail beds proceeds over the nail, so that's healthy. I'm going to check for turgor. So you're well hydrated. That's good. And then capillary refill. That's good. All right, let me check your pulses. Brachial, radial pulse. Perfect. Perfect, and those are equal bilateral as well. And then I'm going to check your radial pulses. Great. All right, can you say that for me real quick? All right, can you do this, and then this, and then this? Okay, so therefore I'm just checking her range of motion. All right, very good. All right, if you have one more seat, I'm going to check the lower portion of her. Oh, we do something real quick. So I'm making sure that her shoulders, her elbows, her wrists, and her fingers are all symmetric, and they are, so that's good. All right, now we're going to do the lower extremities. So therefore I'm feeling the temperature, it's warm to touch. I would check for any lesions on the skin and see if there's any bruises or anything that would concern me that I need to look at. So after that, and then I'm going to check for, I'm going to take these off, okay? Thank you. I'm going to check for any edema on the skin. No edema there. Good. And then I'm going to take this off just to check your capillary refill on your toe. So if your toenails are painted, what you can do is you can go on the side of the toe and squeeze. And there's that. Let me do this one real quick. And do the same thing for this one. Perfect. And while I'm here, I'm going to check the pulses of on the feet, posterior. Use my finger. This is my plantar pulse. Those are equal bilateral, and then the posterior tibial pulse. Right here. Okay, and can you put your foot dorsiflexion, which is you're just going to put your feet like this, and then back down, and circle them around. Good. Okay. Ooh. Okay, let me move your shoe. I'm also going to make sure that the hips, knees, and the ankles and toes are all symmetric, and they are, so that's good. If you'll lay back down, real quick. Okay. So if you can put your leg up, and then your knee up that, and then back down for me, okay? Can you do that for me? Okay. One more time. One more time. Okay. You're good. Sorry. All right. Now, if you can push my hands down. Great. Okay. And then could you pull your feet back up? Perfect. Good. And let me do that on your hands. I forgot to do it earlier. So if you could just grab my hands. Grab, squeeze. There you go. And push my hands. All right. And then pull my hands. Perfect. Okay. Let's see. I think we got that done. Okay. If you can stand up one more time. Sorry. Okay. So can you bend down? I'm going to look at the spine now. Just bend like that. There you go. So I'm going to palpate the spine. Does this hurt or anything? Perfect. Now I'm gonna look at the range of motion of the spine. So you can follow me. So do this, this, and I want you to lean forward again, and then try to lean back. Does it hurt at all? Okay, and could you walk to the chair and back for me? Checking her gait right here. Perfect. And then I also, at the beginning, I did assess her skin, the top and the bottom of her body to make sure there's no skin lesions or bruises. And it's the color is normal for her ethnicity as well. Do you have any questions for me?
No.
Okay, well thank you very much and you have a great day.
You too.
Thank you.